Welcome to the AARDY.com YouTube channel. I'm Jonathan Breeze, the CEO, and this is a short video to go along with our Medicare page on Medicare Part D. So what is Medicare Part D? Well, Medicare Part D is prescription drug coverage for Medicare. It helps cover prescription medication costs and can also include vaccines. So how does Medicare Part D work? Medicare Part D provides access to prescription drugs with affordable copays. Before Medicare Part D came out, Medicare recipients paid for most medicines out of pocket, since Medicare Part A and B did not cover all drug costs. So Medicare Part D in a glance. Private insurance companies operate and process claims for Medicare Part D plans. Includes coverage for both generic and brand name drugs. Has 4 tiers of coverage. The tier determines how much the drugs cost that Plan D will cover. The cost depends on which Plan D you choose, your medication needs and preferred pharmacy. Compare plans each year because lists of drugs change as well as the costs. So how do I get Medicare prescription drug coverage? You should enroll in Medicare Part D when you sign up for Medicare Part A and Part B. If you postpone registration, you may pay a higher price indefinitely. Medicare insurance marketplaces like AARDY offer Medicare Part D plans at affordable prices. If you have a Medicare supplement, you will buy a standalone Medicare Part D drug plan. Medicare supplements are not allowed to include Part D. However, if you buy a Medicare Advantage plan, it might include prescription drugs already. If you have a Medicare Advantage plan, Part D is redundant and you would need to drop the standalone program. If you don't, the Medicare Advantage plan might disenroll you. So what does Medicare Part D cover? Well, Part D plans have a list of covered prescription drugs called a formulary. This list may vary depending upon which provider covers you. If the drug you use isn't on your plan's formulary, you pay full retail price instead of a co-payment or co-insurance. In some instances, you may qualify for a formulary exemption. One advantage that Medicare offers is that they negotiated lower medication prices, so using drugs on the formulary saves you money. Also, generic drugs cost less than brand name drugs. So how much does Medicare Part D insurance cost? Well, regardless of where you get Part D coverage, you will pay a monthly premium. Depending on your annual income, you would pay the plan's premium plus an additional monthly fee. However, if your individual annual income is less than $87,000 or joint annual income is less than $174,000, you would not pay any additional monthly fee. Each plan also has a deductible of $435 or less that you must meet. Fortunately, some programs have zero deductible. After you pay the deductibles, you have copays and co-insurance. An example of a copay is picking up a monthly drug refill and paying a flat $10 per prescription regardless of the cost. Co-insurance means that you pay a percentage of the total drug cost, like 20%. Your costs depend on several factors: which plan you choose. Now this affects your premium and out-of-pocket costs like copays, which drugs you need, if your plan covers the drugs you need, and whether you use a pharmacy in your network. So how much does medicine cost with Medicare Part D? Well, prescription drug coverage works on a tier system. Lower tier drugs cost the least and higher tier drugs cost the most. Most generic drugs are on tier 1, the lowest, and have a small copayment. Preferred brand name prescription drugs fall under tier 2 and you pay a higher copayment. Brand name drugs that are not preferred by the plan are in tier 3 and you'll pay a higher copay. Finally, tier 4 prescription drugs have the greatest copayment. Sometimes you can file for an exemption. Your physician may believe you need a drug from a higher tier, but there is a similar drug on a lower tier. However, the higher tier drug is more appropriate for your condition. You would file for an exemption to ask for a lower copayment.